Corticobasal degeneration, or CBD, is a rare neurodegenerative disease that affects around 5 in every 100,000 people. CBD is characterized by abnormal buildups of a protein called tau within brain cells, which damages the cells and causes brain shrinkage over time. Usually, tau proteins help maintain the structure and communication of brain cells. However, with CBD, the tau proteins misfold and form clumps called neurofibrillary tangles. These tangles disrupt the cell structure and ability to function properly. Signs of CBD generally begin on one side of the body. Symptoms include trouble with balance and coordination, stiffness and slowed movements, muscle twitches or jerky motions, and difficulty speaking or swallowing. One unique symptom is called alien limb syndrome, a phenomenon where a leg or arm seems to move on its own. As CBD progresses over multiple years, these symptoms worsen, and in the later stages, individuals may lose the ability to walk or talk completely, needing assistive devices like wheelchairs and significant support in daily life. CBD is often misdiagnosed as Parkinson's disease in the early stages due to the similar motor symptoms. However, while both conditions affect movement, CBD progresses much faster and does not respond well to Parkinson's medications such as dopamine drugs. This lack of response is one of the key clues that helps doctors distinguish CBD from Parkinson's. CBD also affects the brain differently than Parkinson's. While both conditions damage the basal ganglia, an area that controls movement, CBD also damages the cerebral cortex. This additional brain shrinkage can lead to problems with planning, memory, and emotional regulation. When it comes to diagnosing CBD, the process is not straightforward. Doctors typically begin by performing a physical exam, symptom evaluation, and brain scans. They might also test blood or spinal fluid for elevated tau levels. However, because other diseases like Alzheimer's also involve tau, a definitive diagnosis of CBD can only be confirmed after death through an autopsy. That said, researchers are currently working on better diagnostic tools, including advanced scans that use tracers to more accurately detect tau accumulation. So why does corticobasal degeneration occur? As far as we know, CBD occurs by chance. However, research has shown that many people with CBD have variations in the MAPT gene, which is responsible for producing the tau protein. In addition to genetic factors, aging plays a significant role. The older you get, the higher your risk of developing CBD. Scientists are still investigating whether other factors like environmental pollutants and head injuries might contribute to CBD. Because there is currently no cure for CBD, the focus is on managing symptoms and improving quality of life. Treatments include physical therapy to help maintain balance and muscle strength, occupational therapy to assist with everyday tasks, and speech therapy to aid with communication and swallowing difficulties. Additionally, support groups allow patients to connect with others who understand what they're going through. Their local healthcare team, including neurologists and therapists, can also help develop a care plan meeting their individual needs. In summary, CBD is a disease that affects both movement and cognition, caused by tau accumulation in the brain. It usually starts on one side of the body, and while it shares some features with Parkinson's, it progresses much faster and doesn't respond to Parkinson's drugs. Although research is still ongoing, factors like variations in the MAPT gene and aging play a role in its development. If you or a loved one is affected by corticobasal degeneration, remember that you aren't alone. In Canada, organizations such as the PSP Society of Canada and Alzheimer's Society of Canada offer up-to-date resources and information. Thank you for watching.